But then your benchmark becomes, well, I want to be as busy as they are, or I want to be as busy as that clinic, or I want to be as good as that injector. And then you're always critiquing yourself and saying, I'm not good enough. And I think sometimes we're too harsh.
I remember one of my first treatments was Botoxing a member of family who I won't mention 2 weeks before Easter. And just knowing that I was going to be seeing them on Easter and whether or not I was going to have to sit opposite the table with them having a drooping brow.
There is an element of you have to fake it until you make it. You're going to inject your family and friends first, get amazing pictures from them, and then you're going to be promoting those to try and get paying clients.
Plastic surgery is a field where they primarily focus on scalpels and blades and cutting, and injecting is a different art altogether. And we're introducing product into the face, whereas plastic surgery is often removing product.
Read the manual before you come to training class.
That's a really good tip. I see that all the time, but no, absolutely. Hi everyone, welcome to another episode of Sliding into the DMs, the Derm Medical podcast where we discuss all things aesthetics, business, career, as well as other opportunities. Today we're joined by my co-host, Dr. Matthew Pybel.
Hello.
Dr. Natasha Murcott.
Hi.
Will be our guest today. And we're going to be discussing the journey of a dentist into the world of aesthetics, as well as then becoming a derma trainer and really sort of establishing herself into the industry in general. So let's get into it, Natasha. So do you want to introduce yourself and tell us a little bit about your journey?
Yeah, so my name is Dr. Natasha Murcott. I graduated as a dentist from Birmingham in 2016. I started aesthetics in my foundation year straight away. And then I think around 4.5 years ago, I came to join Derm Medical for some masterclasses and the level 7 qualification. At this point, I was approached by Sana and asked if I wanted to join as a trainer. In the meantime, I'd established my own clinics in Whitechapel and Paddington and Birmingham.
So tell us a little bit about the early days, because you got in very young, so you were very much a foundation year dentist.
Yes.
What made that decision so early on in your dental career?
I think as soon as I found out in university that I could do it, I decided that I was going to. So it was just about saving up for the course, really. I think one of our lecturers had mentioned that you could have Botox in your master for grinding. So once I knew that, I think cosmetic dentistry and facial aesthetics was going to be my journey.
So how many years are you now down the line from that?
2023. About 7.
Wow. Okay.
Yeah.
And what would a typical week look like when you were a full-time dentist to what you are now?
I'd have patients Monday to Friday, 9 to 5, and then I'd see patients in the evening, and then I'd be teaching Saturday, Sundays.
Wow.
Yeah.
Very busy.
Very
So it was quite a lot. Yeah.
It's probably good you started young.
I think so. And then obviously I reduced dentistry down to 2 days a week. And at that point, something had to give. And I was enjoying aesthetics a lot more, and it's mine. So I decided to step away from dentistry 2 years ago, and I've been full-time aesthetics ever since.
Wow.
And do you look back?
No. Apart from I have family or friends that are asking for appointments.
Yeah. So tell us a little bit about your typical week now, Natasha, because obviously you're a derm medical trainer, you have your own clinics, you also do a lot of training and other work in the industry. So tell us a little bit about an average week as an injector.
An average week, I'm probably doing 3 clinic days. I work in my own clinic in Birmingham and in London Paddington. I work for another clinic in Edgbaston and also the Derm Medical clinics on Harley Street.
My goodness. That's a very full week.
Yes. But I'm enjoying it, so it doesn't feel like work, so I wouldn't mind. But you wouldn't have found me doing this for dentistry.
What do you enjoy most about the aesthetics compared to what you were doing in dentistry?
I think the patients that you get, I think it's really nice. You can build a relationship more. I think when I went into dentistry, I always thought that you'd be able to help and you'd build these amazing relationships, and you can. But I think it's easier in aesthetics because you don't have that barrier of fear. A lot of patients that come to you when you're a dentist are quite scared. And so they don't really have that trust from the day one, if that makes sense.
Well, I kind of understand where they come from. I've seen some of the equipment you use.
I mean, sometimes the dental
Says the
nurses don't know how when they're suctioning your mouth and they're quite rough with it.
Exactly. Also says the surgeon.
Yeah.
It's true. Well, I think I've seen more blood sometimes from my dentist appointment than from my operations. But
Yeah.
So tell us a little bit about the challenges a dentist faces when they're coming into the industry. What made you train in aesthetics, and then when you went down the training route, what sort of challenges did you face getting established? Because I think people always assume having a dental background means you're very familiar doing hands-on procedures. So dexterity
Yes.
isn't usually the problem or the worry. It's and compared to an NHS doctor, for example, or a nurse, where we don't have any business experience, dentists are already mostly doing private or dental practice-based work. So they're already used to talking about money and making treatment plans with finances involved. So what were the challenges for you? Because they're probably quite different to what me and Matt faced.
Yeah, I think the advantages is that you have a room ready. You've got an existing patient list. You are more comfortable injecting generally, I think. But then I think the challenges is probably trying to convert your dental patients to aesthetics. It can be quite hard in almost a more medical setting to then try and bring up the conversation. So I think advertising, building up your social media, building up a brand, almost before you're trying to advertise amongst your patients can be a way, because you've just got images on the wall and then they can inquire rather than trying to prompt that conversation.
And do you think now in 2023 it's easier because there's much more awareness generally? I know my dental colleagues are also saying they find it easier to get patients now that are coming in and almost wanting a smile makeover or a cosmetic work done. So there seems to be a huge shift towards cosmetic dentistry in the last 10 years. And then aesthetics has quickly followed suit. So it makes sense to offer it all in-house.
Definitely. And I think also when you're starting to do cosmetic dentistry, it's easier to discuss with your patients because you're taking a picture of their smile and then you're saying, okay, well, have you noticed this smile asymmetry? This isn't something we can correct with braces. This would be more lip filler or Botox around the area. So I think that's a way that you can kind of get around it a little bit.
The foundation course is our most popular course here at Derma Medical, and for good reason. It is the best way to start your aesthetic journey, as it will teach you everything you need to know to get started in the industry. Our foundation course is split into two key components, the morning lectures and the afternoon clinic. The morning lectures will include information on many things, including the consultation process, consent, dealing with difficult clients, how to open a business, and the theory behind administering high-quality anti-wrinkle and dermal filler treatments. The afternoon session will run like a real-life clinic. You will be able to perform the treatments you have learned on live models under the guidance of our highly experienced trainers. You will be split into small groups to ensure maximum injecting practice. By the end of this foundation course, you will be proficient in the following treatments: anti-wrinkle injections to the forehead, frown lines, crow's feet, and brow lift, and dermal filler to the lips, marionettes, and nasolabials. We look forward to welcome you to our foundation course soon.
I see a lot of treatments will go hand in hand. So things like master Botox or gummy smile Botox or lip filler, corner of the mouth filler are very sort of lend themselves to practicing as a dentist. Do you ever get any patients questioning you if you're doing temple filler or treatments of the hands? Or
No. I think occasionally you might have patients that are sort of asking about your qualifications generally. It's still quite rare. Obviously, I hope it happens more. But usually I think they're really happy to be injected by a dentist. They might even, I've had a couple of people say they'd rather be injected by a dentist because of the head and neck knowledge, which is interesting.
Yeah.
I think very trusted profession generally. I trust them to perform an injection in my gums.
Yes.
to wander around my eyes or
Just
something.
a little bit
It's
closer.
not too far off, yeah. How about in terms of Natasha? So obviously, from a business perspective and financially, what do you think the lifestyle of an injector should appeal to a dentist?
You can do a lot less work, really, to try and meet the finances that you might have had from a hard day. I think it's quicker appointment times, and it's a couple of injections, whereas normally the injections would be the start and the easy part of the procedure, and then you'd be into more challenging, obviously drilling on something that's probably the size of your little nail, or someone's trying to lick the drill or move their head, is quite challenging. And I think generally the injecting procedures that we do are lower risk. There's low risk of litigation, which can also be quite relaxing for you. If you're looking at the amount you pay for your dental insurance, almost matches what you're paying annually as an injector. So monthly compared to annually.
I think that's an interesting concept, Matt. Plastic surgery and dentistry, they seem to obviously be areas where patients are used to paying for the treatments, and then they are very much have high expectations of the results, and they can be quite litigious. And I know the GDC often isn't kind when they're investigating dentists. So I think I understand why some dentists want to shift away from the pressures that they're facing from their patients in the demanding nature. Do you find that same sort of pressure when you're injecting, when they're having their Botox or filler from you?
No.
It's a different environment?
Yeah, it's a completely different environment. I think with injectables, everything we do is reversible. Obviously, if you're removing anything from the body, so tooth tissue, teeth themselves, that's not reversible. So I think patients generally, if you explain it properly to them before, they understand that they might not have the perfect result that they're expecting, but the treatment is temporary or reversible if we're doing filler with hyalase.
I can't grow a tooth back.
Can't grow a tooth. Not yet. Not yet. Exactly. But obviously we can dissolve and refill.
Okay. So I just wanted to touch upon the training. So Matt, you've trained with a non-dermomedical training provider and dermomedical. Same with you, Natasha. You've also gone down the route of level 7, and Matt's our level 7 lead. So tell us a little bit about the differences you might have experienced in our training versus other providers.
So when I started in my foundation year, I didn't really get that much detail on complications. So I think when I was out and practicing, I could feel that difference. So I was quite apprehensive to take any steps forward to more masterclass teaching. I actually had a friend who had trained with dermomedical, and I discussed it with her. I said, how are the complications? And she said it's explained really good. So I booked in for all the masterclass training with you guys, and then also did the level 7. And I think it lived up to it. I think the complications were explained very thoroughly. Everything was anatomical based. It was landmark. It made me feel safe. So I didn't feel anxious taking those steps forward to progress.
Level 7 is a big commitment, isn't it, Natasha? Do you find that doing that has helped you sort of understand the anatomy in more detail on top of your dental training, and also just feel more confident managing things like complications?
Yeah, I think it helped me most towards teaching, because I think all the sort of questions that you might get asked from delegates when they're starting out, so about advertising, how to get your products, the insurance company for products like that, I think it mainly helped me with that, because I think anatomy-wise, that's taught on your courses anyway, and then we have that from our medical degree. But I think it's probably more the minor details that you don't really think of until you're on your own out there that I gained the most from the level 7 qualification, as well as injecting experience.
So I've not done the level 7 myself, and I know you haven't either.
Nor have I, no.
But it is becoming more sort of a topic that's discussed around at the moment as we increase the regulation that people are needing.
Also with patients, I think, because they almost, like Natasha mentioned earlier, they want to know how much you understand of that topic. And I think they're now coming away from where I used to get patients who would see that they've gone and had injectables from a plastic surgeon as the authority because they're a plastic surgeon. But now they're kind of realizing that plastic surgery is a field where they primarily focus on scalpels and blades and cutting. And injecting is a different art altogether. And we're introducing product into the face, whereas plastic surgery is often removing product. So it's a different skill set altogether. So now they're actually coming and saying, rather than asking what my background is, they want to know, how much have I trained? And I think obviously now my patient population know that I'm a trainer or I've been doing it for a number of years, and that kind of really helps, as well as seeing my portfolio. But for those coming into the industry where someone might have completed a 1-day or a 2-day course, and they might not complete any further training for a number of months until they feel confident, the level 7 gives a standard, a platform, a structure for them to work through, isn't it?
Yeah, absolutely. I think the level 7 gives them that. Well, they've done at least that sort of 6 months, a year-long course where they've learnt all of that background of aesthetics, and they've learnt to apply that into patients. Because outside of the level 7, it's very hard to tell who's just done a 1-day course and who's actually gone on, like Natasha, and done masterclasses and complete facial transformations. I think it's very hard for them to notice that.
I think the interesting thing I want to touch upon is, by the way, guys, do like, share, comment, and follow for more amazing content like this, and there's more to come so far. But on this topic, I get lots of people on Instagram, and they're trying to build their presence, and it's a very competitive industry. There are a lot of patients out there, but then they often flock to who is the most popular injector in the local area. And then everyone's always trying to compete to get to that position. And you see this on Google rankings, and you see this on social media, and you see this in generally even in terms of the number of reviews someone has on their page. But they quickly do a one-day course, and they call themselves an advanced injector after a one-day course. What are your thoughts, both of you guys, on that?
Natasha,
on these terms,
let's see what you
master
think.
injector.
Yeah, I think it's difficult because you have to start from somewhere. And especially like for our delegates that are going out there is an element of you have to fake it until you make it. You're going to inject your family and friends first, get amazing pictures from them, and then you're going to be promoting those to try and get paying clients.
Yeah. No one's going to call themselves a junior injector.
Exactly.
I think fake it till you make it is such a big term that's used in this industry. And it couldn't be a truer one. I think when you start, you have to evoke a sense of confidence.
Yeah.
And it's the same for plastic surgery. When you start as a plastic surgery consultant, you have to exert an element of presence, an element of confidence, an element of experience. And if you don't, the patients, you say, will just go to someone else. And I guess it's how do you do that? And sort of, when did you feel that you were no longer faking it and you'd made it?
Hopefully
Never.
by now.
No. I think there's always elements, really. I think especially when you're teaching, there's just constantly scenarios, really. I think generally as women as well, there's something called imposter syndrome, which is even when you're there, you've got all the qualifications, you're supposed to be there, you always have that sort of doubt of being found out, being a fraud. But
I think that's just self-critiquing, isn't
exactly.
it? We're more harsh on ourselves
exactly
than what we expect from even our colleagues.
perfectionism. So yeah, I think, but generally, I think I probably, after you've done one procedure, even if it's just one injection into the face, I think you have a huge sense of relief after you realize that you didn't have a complication. So I think you have this huge sort of step up in confidence. And then you probably plateau a bit, you plod along, do a couple more, and then you might have a little complication and you drop again. And then you think, why did I have that complication? And then you soar again. So I think it's kind of constantly reevaluating. And as experienced injectors, we still get complications. We're still going to have knocks occasionally. It's just about getting up and learning about it and progressing.
It's that curve where you kind of see it, and it applies to, I first found it when I was in this anesthesia, and they say you have this low level of confidence when you don't know much about it, then you know a little bit and you're very confident about it, and then the more you learn about it and what can go wrong, your confidence really drops off. But you're more experienced because you know more. So you know more, but your confidence level seems to go down. It's only really then after having done it for a number of years or a while or a high number of patients, then does that confidence start to climb again. But it's that ignorant moment where you feel like you know enough and you nothing can go wrong.
Absolutely. And I sort of set you a bit of a difficult question there, because I think you never realise. And it's only really when you get to the level that we all are, and you suddenly sort of look back at your career, and you're like, well, actually, at some point, I definitely made it. Now, but when was that?
The goalpost changes because, at one point it was, I'll have made it when I see one patient a week. To I shall have made it when I do a full day clinic per week, or I shall have made it when I turn over this much money per month. And your goalpost keeps changing, and your colleagues that you seem to associate and network with in the industry will change too. So then your benchmark becomes, well, I want to be as busy as they are, or I want to be as busy as that clinic, or I want to be as good as that injector. And then you're always critiquing yourself and saying, I'm not good enough. And I think sometimes we're too harsh on ourselves.
I think with 5-year plans as well, like setting those can be quite useful, and then also looking back on them. Because I remember, like, it said in mine, have a full day of clinic, like you said, and then you look back, you think, oh yeah, well, those are the days.
Then you get to the point where you don't want a full day, but you want to do an day because you're like, I need a breather.
So it's thinking bigger, I think. I think when we start out, especially a lot of delegates come in and they say, okay, well, I want to work for a clinic. And you think, well, why do you want to work for a clinic when you could have your own clinic?
See, that's a very dentist mindset, because a lot of dentists, they work as associates in a dental practice. They like the ease of turning up and everything's ready, a list is booked out for you, and they can do a lot. But in terms of financial sense, you're taking home 50-45% or whatever the associate rate is. Whereas it's the same when you're working for an aesthetic clinic. Yes, it's good experience, but long term, you're sacrificing your own business from growing.
Exactly. I think when you're working in the NHS as a doctor or as a nurse, you're actually quite institutionalized. And the idea of taking that step out to do something completely on your own is so far-fetched that most people need that stepping stone to say, well, actually, okay, I'll still be institutionalized, but just for a different company. And then they build up that experience, they build up that confidence. How did you make the sort of leap to, so obviously now you're doing a lot of aesthetics and full-time aesthetics compared to dentistry, but how did you make that leap to get your first 10 patients?
Word of mouth, really. I think I injected friends and family first. And then I do think that there was probably like a
common thing we're
3-month...
hearing, isn't it? Sort of on these podcasts,
Yeah.
that people are injecting their friends and family. And that's the way they're starting.
Of course. And then word of mouth, really. I think there was probably a 3-month period where people were watching the friends and family and just making sure that nothing went too wrong.
Yeah.
I think also in those times there was more caution. Nowadays, I find people are more willing to come and have these treatments.
Yeah.
And not just because I've been doing it for years. I find that they don't even want to really care about who they see in my clinic. They're not particular about an individual injector. They're just like, I want to be seen and treated tomorrow.
Yes.
And they're confident in these treatments because there's more awareness. But I think when we all started years ago, it was still a bit of a taboo topic. It was still a little bit experimental on the cusp.
I remember one of my first treatments was Botoxing a member of family who I won't mention 2 weeks before Easter. And just knowing that I was going to be seeing them on Easter and whether or not I was going to have to sit opposite the table with them having a drooping brow.
The Facial Contouring Masterclass introduces you to true tear trough treatments, nose filler, jawline filler, and advanced chin filler. At this course, we will introduce you to the Cosmetic cannula. These treatments will be a great addition to your clinic, as you'll be able to refresh the eye area and start to combine treatments to help your clients achieve contour and definition. You will need to have completed foundation and advanced dermal filler and anti-wrinkle training to attend this course. You do though. I think it's normal. Yeah, mine fainted, my first patient. So
wow.
Yeah,
And
they faint all the time in dentistry. So
of course.
They're used to it.
It's okay, just lift the legs up.
So Natasha, what about what tips would you give your dental colleagues right now, those in foundation dental training, or those that are established, or those dental practice owners who want to diversify their practice and offer more in-house? What would you say they should do next steps wise? What's the next step for them?
I think if you're thinking about booking a course, I'd actually recommend trying to build up a little bit of a list before you come in. So send out some e-shots, start advertising.
What's an e-shot for those that don't know?
So a little email to your patient base. So if you're sending them newsletters, you could send out in a weekly newsletter that you're going to be starting to introduce this to the practice.
Like a pre-registration.
Exactly, like building a waiting list. Because then it means that you can hit the ground running after you've invested in the course. But you've got hundreds or thousands of patients that you have access to. I think also involving the team. I think as dentists, in-house referrals work really well. So even if you're the person that's done the course, have a clinical meeting and get everyone educated in what you're able to offer, so that you can make sure that everyone is referring when needed. And that's also a really good way to sort of build your list in-house.
And what controversial question, who do you think's the better injectors out there? Dentists, doctors, nurses, other allied healthcare professionals, or non-medics?
From what I've seen, I think dentists seem the most confident on the training days. Obviously, I don't go home with
no
them,
bias.
so I can't, no bias. But yeah, I think we're used to injecting in that area. Obviously, people vary. There will be some people that aren't, even though they're dentists. But generally, I'd say the dentist. Sorry, guys.
Well, I've never been asked to do a beautiful cannula or a beautiful blood taking. It's, but whereas when you're working with teeth, people that want beautiful teeth. Yeah. So I suppose that's innate.
We're also used to people moving more than surgeons, I think.
Yeah, my patients don't tend to move much when
they're
they're
unconscious.
Well, I've done a very poor job if they do move.
Well, that's true.
So the next thing I wanted to ask you, Natasha, is tell us a little bit about business considerations, because obviously when you're looking at a dental list, your list to grow, because patients might not come back and have a full set of implants or teeth straightening, Invisalign, all these things. They're only really going to be your patient once. Generally. They're not going to then come back every 1 or 2 years to have the same work done again. How does that vary from a business perspective for aesthetics? Because a list can grow quite quickly, isn't it?
Exactly. From the dentists that I know that do Invisalign, for instance, I think they feel a lot of pressure in getting people through the door. Whereas with the patients that we're seeing, they're coming back every 3 months minimum, really, and having combination treatments. So you might be doing 3 or 4 mil of filler and 6 areas of Botox, for instance. So you're kind of getting the same money value from them for these treatments that they're going to come back for. But also the lab bills, when you're starting doing Invisalign, they're almost a third, sometimes more, for the actual cost of the procedure. And you have so many visits to complete them.
Is it time in the chair? Is that what you guys refer to,
yeah,
isn't it?
exactly.
Yeah,
Time in the chair time.
Yeah.
There's a lot of chair time. So although the initial money that the patient's paying can feel like it's going quite far, actually, when you're looking at the time, especially when you're starting out, if you get quicker, then it might add up a little bit.
Versus filler or Botox, which just might be a one visit.
Exactly.
And then they're going to come back, and next time they come back, they pay again.
Yeah.
Every time.
And they usually pay more. And I found that patients who have never done any treatments before will come for Botox. And then once they've done that, they're just talking to a full facial consultation, and suddenly they're thinking maybe, oh, actually, my tear troughs or my chin or my jawline, and it actually progressed. Whereas I guess with your teeth, once you've done the teeth, you've done the teeth.
That's it.
Exactly. You're maintained.
Yeah.
But I think you also get friends and family coming in from the clients. So I think once you've got one person that you're injecting, they generally tend to send you 3 people and then another 3.
Yeah.
What about injecting for other establishments? You've worked for a clinic in Edgbaston.
Yes.
How do you find working out of a dental practice altogether? Because this is purely an aesthetic clinic. You're not really in a dental practice at all, isn't it? You're working for an aesthetic clinic. And how do you find working for an aesthetic clinic versus being in a dental practice offering these treatments?
It's interesting, actually. I think the staff probably a lot happier.
Okay.
I think
it's more of a spa type feeling,
exactly.
isn't it?
It's more. I think so. I think
it's
a lot more. It's relaxing. I think obviously we try and make dental practices relaxing, but I think the fear kind of does come through a little bit, especially in the waiting room. Whereas I think it is more relaxed for aesthetics. Like people are looking forward to treatments. They're excited in the waiting area rather than terrified.
I just want to go back to a question which we've asked on some of our previous podcasts to people in the medical, nursing, and allied professionals specialty. And that's really about support that you had from your colleagues, because people who have been working in NHS tend to feel very sort of stigmatized or almost ostracized for doing these sorts of treatments. And is it the same in dentistry, or is there generally a lot more support?
No, I think you'll always come across 2 types of people, really. You'll have the sort of hardcore, almost surgeons, really, in dentistry as well. You have oral surgeons that are very sort of health-based. But then you also have the cosmetic dentists who I think would be very open to it. So I've never personally felt any negativity towards doing it. I think all my colleagues, for instance, were excited for me. I think they could tell that I loved it and that I was probably always supposed to do this.
I think that's interesting, the mentality shift. Whereas in the dental community, it seems like doing aesthetic training and offering those services is a wise business decision.
Yeah.
Whereas in the NHS, it's like, it is a business decision, but it's, how dare you have a business mind?
It's just like cheating.
It's like cheating. It's like, you must be financially stable by the time you're near retirement in the NHS. That's acceptable.
Exactly.
If you do it earlier, it's like, what was the shortcut? How did they cheat their way through? And it's not. It's hard work and graft, actually, isn't it?
Yeah,
to build this practice up.
Yeah.
So Natasha, what would you say then, having done this and been through the journey, if you were to do it all again tomorrow, would you? And next question, where would you start? Where would you recommend starting?
Yes, I'd do it all again. I would have started again at the beginning. I kind of did the course as a bit of a taster to see what it was. I didn't really plan for all of
so
this
you didn't take it as seriously as you
yeah, exactly. So I just kind of rocked up just to kind of see what Botox and filler was.
Classic dentist. I haven't read the manual. I've turned up. I'm ready. Teach me everything.
Yeah, I think so. Whereas actually, if I'd maybe delayed it a little while, because I think I was still very young. I'd only been a qualified dentist for a couple of months.
Okay.
Maybe towards more the end of the year, and then I could have planned through that year to kind of build up an awareness within my patients, friends and family. And then I think it would have been easier to hit the ground running,
Yeah.
really getting marketing and social media and stuff up and running before the course.
And being from a dental background where you guys attend composite bonding training and you attend implant training, there's so much training out there from a dental community perspective. I didn't realize in the NHS most of our training is on the job training with a consultant or a senior being your trainer. So you're not really formally attending many training days or training events, whereas you guys seem to be running training events all over the country and you're always going on these fancy dental gala dinners and dental award shows. It's a very different environment. So being so used to going to training, do you think the investment in aesthetic training versus in cosmetic dental training, do you think it's a good value investment?
Definitely. I think, again, the training courses that you do, well, higher level courses for dentistry, are matching the prices as to what training courses in aesthetics are, again. I think you can do more courses for aesthetics than you could perhaps for one of the dental courses. And you make the money back very, very quickly in aesthetics as well.
For dentists who are interested in this, and obviously something you guys do very well at conferences, you have very big conferences.
Yes.
Is the aesthetic sector well represented there, or is there anywhere else they can find this sort of information?
Yes, I think we're coming to the BDIA conference in March, so obviously people will be able to find us there. There's probably a little bit. It's rare. I think I found out about my original training company at a dental conference. I think we are there, but I don't think we're there enough. If that makes sense. I think it can merge a bit better. So I think that's an area that we could do as Derma, really.
Well, I think attending one of our open evenings that we now hold at Derma Medical across the country is a very good opportunity for those that are interested, want to dip their toe, almost a taster. So rather than having to come on a fully paid training course, why not attend one of our open evenings? And then you can also get a little bit more of a feel for what it's like to see filler or Botox being done on stage on live models, as well as understanding a little bit about the way we teach, as well as the way the course is run and the journey into the industry of aesthetics. I just want to thank our host, Dr. Matthew Pywell, as well as Natasha for joining us today. It's been a pleasure.
Thank you, guys.
Thank you very much.
Any last tips that you'd like to give, Natasha, to your colleagues or anyone out there interested?
Read the manual before you come to training course.
That was a really good tip. I see that all the time, but no, absolutely. Well, thank you so much for that, everyone. Thank you for joining this episode. It's been my pleasure to hold this and host this episode. Like always, please like, share, follow, and subscribe to further episodes to get more amazing content from various different professionals coming in and teaching us more about the industry and their journey. I've been Dr. Amit Thiara, and I'd like to join you in many more episodes to come. Thank you.